So this is what happens when you have fasciitis in the distal radius, so the end of the, let's say towards the metacarpal area. It just shows you carpus valgus. So if they ask you one reason, you can get this. If this is an option, it's there. Let me zoom in here. So you will see a number of radiographic abnormalities in fasciitis and physial dysplasia. This shows you a dorsopalmal view of the distal radius. Yeah, it doesn't matter about the rest, but yeah, basically you'll see new paraphysial bone production, so new bone that shouldn't be there. This is known as physial lipping or metaphysial flaring, so just remember that. You'll see increased radiolucency, so it's more see-through or widening of the physis. You'll see asymmetry of the metaphysis, wedging of the epiphysis, metaphysial sclerosis adjacent to the physis, and asymmetry of the cortical thickness. So basically the cortex will be thicker in certain areas, and it's because of stress on the limb, but this is less commonly observed. And you also have angular limb deformities because of this, or osteochondrosis lesions that may be present. So yeah, in terms of treatment, we can evaluate the feed with the multiple animals, store rest, give them NSAIDs for 2-3 weeks, reduce the body weight or growth rate by restricting starch and protein. So remember, starch and protein. Orthopedic trimming and shoeing, that's always an option in all these cases. So with varus, you have to shorten the medial hoof, soleus margin, and glue on a shoe with lateral extension. So basically, let's say this is the inside, this is the outside. The outside's going to be more like this. And in valgus, you do the opposite of that. So just to recap, you shorten for the valgus deformity, remember L for valgus, L for lateral, you would shorten the lateral hoof margin and glue on a shoe with a medial extension. In terms of surgical correction of limb deviations, you can use a periosteal elevation for growth acceleration or growth retardation procedures on the opposite side of the physis, but you have to perform it when they're very young. I think this is a repeat of a certain slide. It looks familiar. Yeah, so this is an example of a growth retardation procedure. So they've clearly used some, I assume that's a Kirschner wire maybe, or a tension band, and some lag screws. Okay. Next, we have cervical stenotic myelopathy or wobbler syndromes. I've seen the word a lot and I always forget what it is. So now you know. So this is a neurological gait deficit. So it's a nervous system disorder because of compression of the spinal cord around the cervical vertebrae. And basically it can either be like the same or forever changing, and it's associated with also narrowing of the vertebral canal from C3 to 6. That could be an answer. And this myelopathy is because of developmental orthopedic diseases. A genetic predisposition does seem to exist, like thoroughbreds and warm bloods and rapidly growing horses between 6 months and 3 years. And also males seem to be 3 times more affected than females. So what do we see in terms of clinical signs? So gait issues, I'm trying to pick a better one. So it progresses to forelimb ataxia over several weeks, and it's followed by stabilization, which is known as the plateau period. And it further progresses to what we call symmetric tetraparesis. So this means all the 4 legs are affected. And the pelvic limb ataxia is more pronounced as opposed to the forelimb deficit. So the back legs are usually worse. So for wobbler as well, I think it's a suitable name because they're wobbly. You have a base-wide stance at rest. You have a proprioceptive deficit, so they're sort of crossing their legs. And yeah, you have other clinical signs. So they might be toe dragging, so that like you can see that's why the hoof is shaped this way. And it shows weakness. The hooves of horses were with prolonged signs. They also have chipped, worn, or squared off at the toe. As you can see, it's squared off. That's the best way to describe this. And if they're moderately to severely affected, they have lacerations on the heel bulbs, which we would call wobbler heels. So yeah, lacerations on the heel bulbs. And on the medial side of the forelimb as well, you'll see the same lacerations. Okay. All right, so you'll see things that are related neurologically, like circling, elevation of the head, maneuvering over obstacles and inclines. You'll see proprioceptive deficits. that basically like circumduction of the hind limbs. I'm just going to show you the words. Posting, so pivoting on the inside hind limb during circling, and truncal sway. So they sort of lean in, I guess. And when they're prompted to back off, they may have, oh, it's not shown here. They may stand base wide, lean backwards, drag their hind limbs, or step on a hind foot with a forelimb. There are more clinical signs. Okay, I'll finish this and then we'll have a break. So clinical signs. So horses have cervical pain, so pain in the neck, and forelimb lameness. So due to peripheral nerve compression, without other clinical signs. They usually travel with a short cranial phase of the stride, so I imagine it's like they move their head, and a low foot arc of the forelimb, so this means that the foot doesn't lift off a lot off the ground, and they may stand or travel with their head and neck extended. So we're going to start with grading of wobbler syndrome next.